Michigan acupuncture community. It's Julie Shindler-Cohen here today on Wednesday, April 15th. I remember that because it's the middle of the month. Yay! We've made it. So I always get so nervous, as I'm sure you know by now. I'm waiting for everything to kick in. There we go. And we're going to have a talk today about tongue diagnosis, which for those of you who come and get acupuncture regularly, or for new patients, you know it's a big part of our treatment plan, and you know that's how we make our diagnosis. So it's really, I find, a topic of intrigue for many. Hello. So we're going to debunk the myth today. But before we get started, let's start with a moment of gratitude. If y'all want to write in what we're grateful for today, I think that's a good way to start. I'm grateful for the fact that this pandemic has happened in Michigan during spring, because although it's cold and snowing today, we've had a lot of beautiful days. So I am grateful for springtime pandemics. And if anybody else wants to write in what they're grateful for, I'm always happy to hear it. So, all right. So we're going to talk about, like I said, tongue diagnosis today. I will take a quick moment to remind you that Chinese medicine is an ancient, energetic, holistic medicine, completely different than Western or traditional medicine, and it's based on energy. So the idea is energy runs throughout the body in channels. Channels are named after organs that we are familiar with: liver, kidney, spleen, etc. But they have nothing to do with the actual organs as we understand them in Western medicine. And when you come in for acupuncture, people oftentimes come in with a chief complaint, a reason that brings them in. Headaches, fertility, insomnia, hormonal imbalances, pain, whatever it is. And we talk a lot about that complaint. So it's not one size fits all. We ask a lot of questions about the presentation. For example, in headaches. A headache that's one-sided is treated different than a headache that presents on the front. It presents differently than with auras or nausea. There's different kinds of headaches, and it's different energy balances. And then, as many of you know, after we ask a lot of specific questions, we ask questions about all other aspects of your health. Sleep, diet, digestion, temperature, all sorts of questions, and it helps us figure out the overall landscape, because we're not just headaches, we're not just our hormonal imbalances, it's a working unit. And then think about it, when you go to the doctor with a chief complaint and they want to understand, they can take blood, they listen to your heart or organs, or run a CT scan or an x-ray. And thousands of years ago in ancient China, they didn't have those, right? And we still don't. So what do we do after asking our questions is we feel the pulses, which might be another discussion. And then we look at the tongue, because the tongue is an indication of the energies being in or out of balance. So let's back up to my talk a couple days ago about the spleen and the jiaos and how we see the body apart from channels, like this: upper, middle, lower. It's a very beautiful, concise explanation of how we work. Upper, middle, lower. And then the tongue is divided similarly. There's a certain area of the tongue that's the upper, the certain area of the tongue that corresponds to the middle, and then a last area that corresponds to the lower. And this is how we see the tongue. So this is the tip. So this is the person's head. The tip corresponds with the upper jaw, the lung, and the heart. And then the middle is the digestion, spleen, stomach. And then the back are the intestines, the kidney, and the urinary bladder. And as an aside, the lateral aspects, the sides, correspond with the liver energy. So when we look at the tongue, if we see certain things going on, we know where they are happening based on that map. But then when we look at the tongue, what we want to understand is the color, the coating, the texture, the geography. That tells us specifics about what's going on in each of those areas. I always joke it's like palm reading. we'll talk to somebody, or I'll talk to a patient, and after discussing things with them, I have a sense of what's going on and what I'm going to do. But when I feel pulses and look at the tongue, sometimes something comes up that I didn't even realize, or I didn't investigate more, and I'll ask a question regarding it, and they'll be like, oh, how did you know? And the tongue doesn't lie, typically. So we look at the shape. Another thing is, people always say, well, what's normal? What's a healthy tongue? Ideally, our tongues are supposed to look like a baby's tongue, a newborn baby's tongue. I don't know how much you look at a baby's tongue. It's not puffy, it's smooth, it's flat, there's some moisture to it, but it's not really wet, it's not coated. It's a nice pure pink. Sometimes I think of like chicken, right? Like raw chicken. That's how our tongue should look. That would indicate a balance. But when things become out of balance, we start to see a change in the shape. It can be puffy, it can be deviated. When somebody sticks out their tongue, it goes one way or another. It can quiver when you stick it out. And we're not asking people to really shove it out, just kind of, which we'll go over in a minute, to look at the tongue. It should be not pointed. Sometimes people have a really pointed tongue, or heart-shaped at the tip of the tongue. That is something we look at. The other thing is the color of the tongue is really important. And I'll remind you, in Chinese medicine, when things become out of balance, we describe like an environment. So when things go awry, we get things like heat, cold, damp, wind, etc. So we want a pink tongue. When we see redness on the tongue, if it's really red, it indicates heat. You might think of this as inflammation, but we would call that heat. It could be pale, which means that it's kind of white sometimes. And I'm talking about the tongue body, not the coat. That would indicate a deficiency, blood or qi. It could be dusky, and dusky is kind of purplish, and that means stagnation. Energy is stuck, right? So the color is really important. The texture of the tongue is really important. Sometimes we see cracks. We oftentimes see cracks, and cracks indicate deficiency. So where you see the crack is really important. Are you deficient in the middle? Sometimes you see shallow cracks along the edges. That's an indication of deficiency in the liver, or at the tip, which is, anyways, in the back. So where the crack is indicates where the deficiency may lie. That's a big one that we see a lot. Sometimes we see something called geographic tongue, which corresponds with Western medicine. People will come in and I'll say, oh, you have a geographic tongue? And they'll say, yeah, I know. My dentist has told me this for years, or my father had a geographic tongue. And that indicates a more serious deficiency in Chinese medicine. You should see my dad's tongue. And then scalloped is something we see with Chinese medicine too. We call it scalloped. So a lot of people call it tooth marked. So when somebody has a puffy tongue and then it looks like ridges or ripples is how I think of it. That is an indication of dampness as well. So it's puffy and swollen, so it's pressing against your teeth. So for us, that's dampness, is a scalloped tongue. We see that a lot. And then coating is really important too, and this is an important concept because when people come in for acupuncture, we ask them not to brush their tongue, which is kind of counterintuitive, I'm sure, for many, because in Ayurveda, Indian medicine, you just scrape your tongue every morning. I think it's just part of natural dental health to brush your tongue. But for us, we want to know what's going on with your coat. We're not judging you. We don't care what your coat looks like, aside to understand what's going on in the body. So we don't want you to brush your tongue coat, and we want to see if there's a tongue coat, how thick it is, how moist it is, the distribution. Sometimes a tongue coat can be peeled in areas, which indicates heat or even toxic heat, which is like disease in certain areas. So we want to understand if the tongue is peeled, and understanding where the tongue is peeled is really important too. Sometimes people can have a yellow coat, and the funny part about this is when people come in, oftentimes people will have a yellow coat, and I'll say, well, what did you eat before you came? And if they've eaten or drunk tea or coffee or, spicy soup or something, then it's not that we don't care, it's that that yellow coating is from the food, it's not from your body, which is a huge distinction, right? Because a yellow tongue coating indicates what we call damp heat, which is treated differently than regular damp and requires different herbs and points and approaches. So the color of the tongue coating is really important. Fun fact, antacids turn your tongue coating black. So be careful. I remember, I think it was in clinic in my schooling where if there's questions, please write them in. Where somebody came in with a black tongue and it freaked me out because that's not so, I mean, we hear about it, but it's really not common. And antacids, Tums, can turn your tongue coat black. So again, that's an external source, not your body showing up on the tongue. And then finally, sublingual veins are under the tongue. And as you can see, I'm not the greatest artist anyway, so I couldn't draw sublingual veins. But when we look at your sublinguals, we have you do like that. And sublinguals are really unique in that they indicate blood stagnation. Blood stagnation means your blood is stuck, which is common in Chinese medicine. And working a lot with women's health and fertility and hormones, this is important to treat. So endometriosis and fibroids, that kind of thing, we really want to work on that. And so how blue, how distended, how purple the sublinguals are indicates the degree to which things are stagnated. I hope that makes sense. It's a little weird, I understand. So please go home, or you are home. Please take a look at your tongue, and you'll get a sense of what's going on. Somebody just asked, are you doing online consultations? We are getting ready to offer our telesupport, and we're almost there. And yes, we will be doing, not online, but we'll be doing, we'll be contacting you through a secure line, Zoom, but we are offering that, and we're happy to look at your tongue and help you out and get you directed with supplements and herbs. Yes. So please let us know how we can help. And for fun, I thought I would invite, I don't want to show you my tongue because I've not been eating that well. But I have a good example with us if you guys want to see. For 1 second. Baba. My son Dean is eager to show you his tongue, and we'll look at it together, and we'll have a look if he comes. Hold on. Dean, come here. He's been so excited for this, and now he's not here. Oh, no. My tongue's a mess. All right, so Dean here is 6, and he's pretty healthy, thank God, but he eats not so great. So he's going to show us his tongue together, and so you need to stick out your tongue. Okay. So, Deanie, let me see your tongue. Uh-oh. He's got a little bit of a crack in the center, which is not my finest parenting moment. Here, look at me again. It's a little red at the tip and kind of coated. So, how are you feeling today, Dean?
Good.
You happy, nervous, anxious?
Happy?
Yeah. So, yeah, a little redness at the tip of the tongue is heat in the heart.
Can I see?
Yeah, can you see? Here. Redness at the tip of the tongue can indicate heat at the tips. Show us your tongue again, Baba. You know what? Let me get a... Hi. Let's get...
Oh, look how much love
I know, because you're so cute. All right, let's look again. Say ah. Ah. Stick it out and hold it. There you go. No, your tongue. See that coating, you guys? No, stick it out and hold it, Baba. There you go. There you go. Okay, so the color is pretty good. The tongue body is pink, which is great. It's a little more red at the tip of the tongue, which is in the heart. And you know, Dean didn't sleep so great last night. He's not the best sleeper, and it has to do with the heart, and we can totally have a discussion like that.
And sometimes I get cranky.
And the coating on the tongue indicates a little dampness, which, you know, luckily for kids resolves pretty quickly, whereas for adults it's more difficult. Dean, have you eaten any dairy today? What have you eaten today? Could be his food, but Dean craves sweets. Remember from our last discussion?
Julie Silver knows that.
Yeah.
I came to work for chocolate.
Thank you. Your spleen,
she's
it's okay, is the middle jowl. Remember we discussed that last time, and the flavor and the taste of the spleen is sweets, which is not uncommon for children, as Kat discussed yesterday, that children tend to be spleen deficient and crave sweets, but an excessive amount of sweets can cause spleen T deficiency. Don't push her. And so the middle jowl has that crack and a little bit of coating. So Dean and I now have our work cut out for us. Don't we, Dean?
Mel.
Thank you for your help. So, yep, thank you.
Mama.
Say hello. You can say hi.
Hi.
So thank you guys for joining us, and I hope you learned something about your tongue. I'm hoping that by the end of this time, with all of our information that we're presenting, you guys will come back in for acupuncture and know so much about Chinese medicine that maybe you can help us with some insight and look at your tongue, and we'd be happy to discuss it now or when we get back. So thank you for tuning in. Be well, take care of yourself and your family, and please let us know if we can help you. It is our pleasure.
Cool.
Have a great day.
He's the cutest.
Yes. Oh, have a good day, guys. Be well.